All right, I want to bring in Carol Williams. She's an intensive care nurse at the Rush Copley Medical Center in Aurora, Illinois. At last count, Illinois had registered 770,088 confirmed COVID-19 cases and 13,782 deaths. A few weeks ago, Carol Williams made headlines when she shared a post on Facebook about her unfiltered experience fighting on the COVID front lines. She wrote in part, quote, "Imagine being the nurse crying with your patient when they realize that everything we're doing to help them still may not be enough and death is a real possibility. Imagine being the nurse or doctor holding that same patient's hand and stroking their head weeks later while their ventilator is removed because they haven't improved and their family then says goodbye and I love you over FaceTime while they take their last breath." Joining me is that nurse, Carol Williams, who works at the Rush Copley Medical Center in Aurora, Illinois. Carol, you sort of motivated me to remind people that we're in this together. We will get through it together, but together means doing the right things together. And you wrote a remarkable post in which you contradicted 13 lies that are out there in the public, but they're lies that actually make it to you. There are people who tell you things in the hospital that are contrary to medical science because they've heard it in the political environment.
Yeah, and that's why I wrote that, because I think it's important for people to really listen to real healthcare providers that are caring for these patients on the front lines.
What effect does it have on you when you are treating people who you know are very ill, who might die, and yet who are still resistant to the idea that this is a real thing, this is serious, this is a potentially fatal infection?
It's unfortunate for those patients that even when they make it to an ICU, that they're not believing in the virus or what's really happening. But the fact of the matter is whether you believe it or not, you are a patient in the ICU now or in the hospital needing very intensive care. So the belief of it's real or a hoax becomes irrelevant because the effects on your body are really taking place, and there's a real possibility that you could die from this virus and the complications that it causes to you.
And you have asked people in your post to imagine what it's like being that nurse. I just read a piece of that. You've asked them to imagine being the COVID ICU patient, the breathlessness, the pain, the fear, the loneliness, the isolation, the anxiety, the hopelessness, and the sadness, the need to use all your energy just to breathe, the true realization that you may not be getting better and facing your own mortality. The truth is that this post you put in could be is more valid now than it would have been 6 months ago when we thought we were at the height of this. You in Illinois, like us in New York, saw the first wave of this thing in April and May. We didn't think we'd be here in December.
We didn't think that we would be facing the same challenges in December that we were facing in the spring, with the disbelief and just the unwillingness to come together for the greater good. So, we didn't think that was going to be an issue here going into the winter months. And yet here we are, and things are worse, much worse across the country, in hospitals, in ICUs, and everybody is stretched. And it's a day-to-day battle with these patients, COVID and non-COVID, with where everybody is going to go.
We're 9 months into this. We may have 6 or 7 months to go before everybody is vaccinated. How are you going to manage through this? Because you did put in your post, and every nurse and doctor we've talked to has said the same thing. We're human. This is hard. You're used to hard. You trained for hard. This is hard at a different level.
This is a level that no healthcare provider in this country has experienced until now. So we are going to lean on each other, lean on our coworkers, because that's who is really understanding what is going on with these patients, and just the amount of burden for the patient, for the healthcare worker, for the system, So we are all leaning on each other.
Carol, I hope you can lean on some of us. I hope the public continues to remember the work that you all are doing. I did like in the early months of this when every day people around this country would open their windows and clap for people like you and frontline workers and the people who delivered our goods, just to remind you that we are grateful. We really are grateful for the work that you are doing, and you will be remembered well. Carol Williams is an intensive care nurse at the Rush Copley Medical Center in Aurora, Illinois. We thank you.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.